everybody, this is Tess with ROE Dental Lab, and today I want to talk with you about some of the basics that go into crown and bridge cases. We all get really busy during our day, and there's the old famous saying, no time to do it right, but time to do it twice. How can you, as the dentist, minimize your remakes at your prep appointment to have the most successful seat visits possible? Today, I'm going to go over that and some tips and tricks we have for you here at the lab. First tip and trick I'm going to talk about is something that, again, is obvious to you guys, but we just want to reiterate here at the lab, being that we fabricate thousands of cases a year. It's a common mistake we still see a little bit too often, and it's unclear margins. I like to tell my docs, if you can't see the margin, neither can we. If you've got blood, saliva, a little bit of water in there surrounding that prep, it's going to be difficult for us to see here at the lab too. So if you need to use some hemostatic paste or retraction cord before taking either your intraoral scan or your impression, that really helps us here at the lab provide clear margins for you, and then helps you avoid at your seat visit running into open margins, inaccurate margins, short margins, all of those margin issues that can prevent us from being able to deliver that patient their crown that day. The second problem we see here at the lab is not enough occlusal reduction, and I'm sure maybe once in your career history, or maybe never before if you're lucky, you've gotten a phone call from the lab saying, hey, we just don't have quite enough occlusal space to be able to fabricate this crown. And that really leaves you with two options. One, we can fabricate an occlusal reduction coping for you, or two, which everybody hates to do, is bring the patient back in for a new prep, and that leads to making a new temporary, and all those extra appointments we just want to try to avoid. So please, when you're at your prep visit, just go ahead and have the patient close down, retract, so that you can see that there's adequate space for the lab to fabricate a crown. And number two rolls into number three a little bit when we're talking about occlusal space, bite. I think you know where I'm going with this. We always want a bite registration when it comes to your crown and bridge cases, and too often we see a little too much material being used. That can kind of bulk up the bite and maybe leave the patient a little bit open, which then again carries into your seat visit, where we're having crowns where the occlusion feels funky, off, not exactly right. We want you to use just enough bite registration material to capture an accurate bite. We don't need a thick, clunky, big bite. We just want to make sure we capture that quadrant. The next one is going to be the patient stump shade. So not always something that you run into, but frequent enough, where maybe we're fabricating an anterior crown, it's an Emax or something layered, and the lab calls you and wants a stump shade. It's a huge mistake I see when offices are sending us anterior cases for the first time. Please, if you're unsure, even if you're thinking, do they really need it for this material? I tell my docs, if you're doing an anterior crown case, send us a stump shade. We know sometimes patients' tooth shades can vary if they've had endodontic treatment, or maybe there was an amalgam filling or something like that that kind of leached into the tooth and makes it a little bit darker. That's information that's really important for us to know here at the lab. And again, without that information, we're kind of going back to bringing the patient back in, getting a stump shade, taking the temp off, the things we definitely don't like to do. And lastly, I want to talk a little bit about the temporary that you guys fabricate while you wait for us to make the crown for you here at the lab. I feel something that gets a little bit overlooked, but we want that temporary in occlusion. We want it having good contacts. I know it feels easy to just open up those contacts or take it out of occlusion a little bit, but that's not the answer. And what that can cause is when you go to seat that final crown, maybe there was a little bit of micro movement over time, maybe the patient had to reschedule their crown seat, all of a sudden a little bit of time's passed and we have some shifting and changing. And what that can cause at the seat visit is interproximal reduction that we have to do because the crown's kind of held up and won't seat, or patients biting down and they're feeling like their permanent crown, which really was their true bite, is a little bit too high, and we're grinding that crown down and doing stuff that frankly we don't want to do at that seat visit. That should be an easy appointment, in and out, remove the temp, seat the permanent crown, patient's happy, you're happy. So please keep those tips and tricks in mind when you're seeing your next crown and bridge patient. And again, I know this is stuff we all know, but sometimes a refresher is nice just to get back to that center point of what can I do to make my crown preps the most successful possible for the team at the lab. Thank you so much for tuning in, and I know we talked a lot about crowns today, but don't forget we are a full service lab here at ROE. We do much more than crowns, like partials, dentures, fixed full arch, implant crowns, guards, and so much more. If you have any questions, please reach out to us directly. Thank you so much for tuning in, and we look forward to providing you with more tips and tricks just like this.